835 on the link, Pacific Points, Cabo Enterprises, IT&E, and Jack in the Box. It's 835 again. Cabo's Insurance counting us for live. Your chance to win coming up. Just keep listening. And when we tell you to call, 671-637-0094, that is when you call. Dr. Hoa Nguyen, he's the former chair of the Physician Advisor Group, heading up the American Medical Center family of clinics. Good morning, Doc. Thanks for joining us.
Yeah, good morning, guys.
I have my COVID-19 data tracker up here. This is the CDC.gov, and I just typed in the Omicron variant, and where Omicron has been detected in the United States. Wow, it's all over the place. And so what I'm looking at here, there's a map. And they also listed territories. It says Guam has no cases of Omicron, though. But, Doc, how did Omicron spread this fast? Because I'm looking at this COVID data tracker. Guys, this is cdc.gov, but if you just type in Omicron variant and then go to the, it's like the second response, and then it's cdc.gov, and you can click on it. And so Washington State, Oregon, Idaho, Nevada, California, Colorado, New Mexico, Arizona, Texas, Louisiana, Mississippi, Missouri, Nebraska, Iowa, Minnesota, Wisconsin, Illinois. It's like everywhere. Doc, what happened?
Yeah.
Did I take a nap or something? I woke up, there's things like all over the place.
No, Omicron is very infectious. It's about 7-8 times more than Delta, which is unbelievable. So, it's going to, they predict that by the next week or two, it will be overtaking Delta regarding infection in the United States. So it's very infectious. But the good part about it is that, you're going to see a lot of people come up positive, the rate going to go up. But hopefully the data show, just like anywhere else, that the symptom is very mild. So the hospitalization and the death rate hopefully will not go up like the Delta, so that's what we were hoping for, and the data so far point that way. Place like in UK, I think they just dropped the ban for traveling to the South Africa country. So I think people realize that, hey, the Omicron is very infectious, but it's not as severe in the illness as the Delta. So it's kind of, we know now that, people that recently have infection from Delta, it's not like you cannot get infected by Omicron. Omicron can reinfect you even if you have immunity from the Delta. So that's what they're looking for, because the change, the mutation, the spike protein has so much change that the immunity from the natural immunity from the infection and also from some of the vaccine, the vaccine work great to protect you, but I think the Omicron bring it down to about 75% efficacy. So they still protected. If you get it, your symptom won't be so severe. But yeah, it's a new change. But
Doc, can we just hold on? Just sorry. So I interviewed Dr. Bob Leon Guerrero of Public Health, and I asked him. I said, "Hey, Doc, so this is last Thursday. I was like, so what do you think the Omicron variant's here?" And he said, "Probably already it is." What have you been seeing at the clinic level, Doc? Because I heard that you guys have been kind of slammed with sick visits.
Yeah, we still see a lot of sick visits, but they're all test negative except one yesterday. So far in the last few days, all negative. I think I did some reading last night a little bit, because I was questioning if the Binax antigen card will pick up the Omicron, and from the Abbott website, they reassure that, hey, the Binax will pick up the Omicron and the Delta. Hopefully, that's what we see, just a viral infection in the community rather than COVID. But Yeah, Omicron will be here sooner or later, and we will see increase in rate of positive in the clinic, and we will inform public health. Hey, there's a lot of infection coming up. So I think right now they send out some specimen, and let's see if the genome sequencing, see is still Delta or not, or Omicron. But yeah, I don't think it's here yet, but we will get here sooner or later.
What are you reading are about the symptoms for Omicron? Because you're not the first doctor that I've heard say that it's milder, right, than Delta. Well, than Delta.
Yeah, I mean, it's have different symptom, and that's a part where it kind of we need to educate the public on do the testing reporting, right? When it's not have a typical COVID symptom like fever, sore throat, coughing. It's mostly fatigue and headaches, So and most people when they have those things, they not so severe that they will come in and get tested, but we'll encourage anyone that have any symptom at all to come in and get tested. So that way, every time you come in, they ask a question about your symptom, and so we document and try to keep track of those things. So during the holiday, when there's a lot of get together and no restriction, I would say that if you have any symptom at all, to come in and get tested before you try to attend any type of get together with your family and group.
So, Doc, I mean, personally, I'm all out of worry. But from what you're saying, it kind of seems like Omicron. I mean, knock on wood. Is this like a big nothing burger, or?
Yeah, I mean, what we hope, and I don't know. This is my personal theory. Is that we hope that if Omicron don't have that much of a symptom, it's very mild, and if you happen to get infected, it's kind of good that it provides you immunity even to the Delta, and it really cut down the risk of hospitalization and death a whole lot. So it's I know it's not good to catch COVID, but Omicron, if it's less severe and more infectious, maybe it will kind of drown out the Delta virus because they need a host to come in. So let's see what happens. We still find out more stuff, and it'll take about a week or two. More information we can get.
Doc, when when the Omicron first started popping up on the news, and I think it was you that we had on, and at that time, the news about Omicron was that it wasn't a severe strain of the COVID because of I guess they looked at South Africa, but then it was you, and you said, "Oh, well, South Africa is a younger population, right? The average age there is like 27 years old or something."
Yes.
But we all know on Guam with all the comorbidities. So I'd ask the question then: are we worried about Omicron because we have a population that carries a lot of pre-existing medical conditions? So I'm going to ask that same question again, given that it's a few weeks later and you have a little more information.
I think even with our comorbidities, Omicron, as much as we know now, as you can see, there's a positive rate in the state that's going up quite a bit everywhere. But we don't see the surge in the hospitalization like we saw at Delta. So I think that if it's going to be the odd, it's not going to affect our population so much, even if the comorbidity. The only thing I really worry about is in Guam is that our booster percentage is so low at this point, and that's an opportunity for the Delta, whatever left in the community, during the get together, during Christmas and New Year, that we might have a positive rate, not on Omicron so much, but on Delta, just because our booster percentages is not where it's supposed to be. So the key here is to get people to go out and get the booster as soon as possible, just so that way during the holiday, Christmas and New Year, that we continue to go into the new year with such a low CAR score and a low positivity rate like we have the last few days.
Doc, there's still Delta out here?
Oh no, it's still there. It's not going to go away. So I'm pretty much 100% sure it's not going to go away. It's still in the community. So that's why it's important for us to pay attention to Delta and get the booster much more than Omicron. I think that we still need to get our people to go out there and realize that if you have your shot more than 6 months ago, that you got to come in to get the booster because we have to still worry about the Delta. Yes, Chris is still out there.
What about the boosters, Doc? I know that you're not happy with the rate that we're getting people boosted, but what are you seeing at the clinic level? Are you getting a lot of patients in who want to get the booster? What are they saying?
We need to do a lot more campaign. I don't see much campaigns that we put out there from the government and public health on the booster. And again, when we see patients in the clinic, I would say that about 60 to 65% of people are way out of the 6 months already, but they still have not get the booster yet until you explain to them, hey, your immunity are way down right now. So if you don't get the booster, you might get sick during the holiday. And then we schedule for the booster right away. So people will get the booster if they have the right information out there for them. Right. That's why I say our main idea right now is not so much on go after the unvaxxed, okay, but the main idea is to educate the public so that way they can get the booster before the holiday.
Yeah, they keep saying they're going to come out with a campaign, but I don't know when they're going to come out with it. Maybe they meant the re-election campaign.
No, they should. They really should do that. Yeah, I know the UOG still continue to the end of the year, so I'm glad that it does not end up on the 15th of December. But again, people take the opportunity. I know take a few hours off from work and just go out there and get the booster as soon as possible. Just because, again, it's really we need to help the whole public to keep our our island safe during the holiday. I said that again, there's a lot of gathering and there's no restriction of gathering, so we really have to make sure everyone is safe.
Thank you, Doc.
Okay, guys. So go out there and hopefully the sequencing, say mostly Delta, but again, the Omicron would be here, but it might not be a bad idea.
So you're saying just the takeaway, guys, is that Doc believes that because of the spike protein mutation in Omicron, that if you get infected with Omicron, it would protect you against Delta. That's what you're saying?
Yeah, it should be. That's what it's saying on the data right now. So again, you have to see which one is worse. The Delta or Omicron. The Delta seems to be a lot more severe. People end up in the hospital and dying. And the Omicron so far, hospitalization still is not going up like the Delta surge, and the death rate is not like before. So maybe sometime it takes a virus to get rid of the virus.
Sometimes it takes a virus to get rid of a virus. I like that, Doc. I like that. Thank you, Doc.
Okay, guys. Take care. And
You
remember, the skill is always there. So make sure you practice that and get the booster.
Thank you.
Thank you. Have a good day, guys.
You too. Dr. Hoa Nguyen, our buddy. Good guy. 3 W's. Yep. Still in play, guys. The 3 W's. Wear your mask. Watch your distance. Wash your fat. Your hands. Wash your hands. Got it. 8:49. We're going to take a quick break. 671-637-0094. That's our number. We're going to do the Calvo's Insurance Count on Us.